March is designated National Colorectal Cancer Awareness Month, and the CDC says that among all men and women who have cancer, colorectal cancer is the second leading cause of death. Every year, about 140,000 people in the United States are diagnosed with colorectal cancer. Colorectal cancer is more likely to occur as people get older. More than 90% of people with the disease are diagnosed after age 50. The average age at diagnosis is 72. The specialists at Advanced Gastroenterology and Surgery Associates explain how colonoscopies play an important role in early detection.
Colonoscopies are very, very important. First, right off the bat, why? Is because it's very important for being able to detect malignancy. That's the most important thing, and colon cancer is very preventable if we are able to diagnose it before it gets there. It just so happens that a person does have colon cancer. If it's small enough and it's not spread, then it's treatable by surgery.
Colonoscopy screening is extremely important, and I think it's important to note that colon cancer is the second most common cause of cancer death in the country and the third most common cause of cancer in men and women. Most patients are reluctant to have the procedure performed, but it really is a preventable form of cancer, as most cancers are. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps, the ones that are adenomas, that can grow and eventually turn into colon cancer. It's important to note that the adenoma cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps. Now, of course, there's some colon cancers that may develop a little bit more rapidly, but the average time interval is 6 to 10 years. So it really is a preventable form of cancer.
For screening for a Caucasian, so white population without knowing anything about the family history, it is recommended in the United States to be, first colonoscopy should be at 50 years of age. In Black Americans or African Americans, it is actually recommended to have first colonoscopy at the age of 45. Now, let's say that a first degree relative, so mom, dad, brother, sister, who have been diagnosed with colon cancer, then the relative will need a colonoscopy 5 years prior to the age of diagnosis of the person with the condition.
According to the CDC, if everyone 50 and older had regular screening tests, at least 60% of deaths from this cancer could be avoided. For more information on colonoscopies, as well as other treatments and surgical procedures available at Advanced Gastroenterology and Surgery Associates, please click the Colorectal Awareness Story link on our homepage, yourhometownhealth.com.